order to understand culture, it is important to assess it. As a nurse, you might treat a patient who is an undocumented immigrant, and you must know how to successfully treat these patients. Most undocumented immigrants in the U.S. are Hispanic and travel from Mexico, so it would be the most beneficial to assess the Hispanic population. This is the Purnell model for cultural assessment. The Purnell model uses 12 aspects of culture in order to inform healthcare workers how their patient might be influenced by their culture as an individual. This allows for healthcare workers to be more culturally competent. The first aspect of culture is overview and heritage. Hispanics are the largest emerging group in the U.S. The terms Hispanic and Latino can be used interchangeably. 66% of Hispanics are Mexican and 99% live in urban areas. 80,000 Spanish-speaking settlers lived in areas lost by Mexico during the Texas Rebellion, Mexican War, and Gadsden Purchase. The next aspect is communication. The primary language spoken is Spanish. However, there are a total of 54 languages and 500 dialects in Hispanic culture. It is common to greet with a handshake, and it is important to take social cues from the patient and family. You may hear your patient talking loudly at a high-pitched and fast rate. It is also important to avoid sustained direct eye contact with elders, and with undocumented immigrants, your patient could be nervous and hesitant to communicate with you. It is important to do your best to make them feel at ease. For family roles and organization, Hispanic families tend to be patriarchal and value children. Children are not encouraged to leave home and are expected to respect their elders. It is important to include all present family members in communication. This is especially important to help build trust with undocumented families who may be skeptical of the healthcare system. There can be a number of workforce issues with the Hispanic population, and more specifically undocumented immigrants. Undocumented immigrants tend to work in poor conditions because they take the jobs that they can get. This can lead to a higher disease rate, more specifically tuberculosis, due to the lack of protective equipment on the job. Biocultural ecology of the Hispanic population shows a higher rate of alcoholism, cardiovascular disease, HIV and AIDS, dental disease, adolescent pregnancy, malnutrition, malaria, cancer, and diabetes mellitus. This Hispanic population also shows signs of difficulty navigating healthcare and utilizing it. The high-risk behaviors that the Hispanic culture participates in include smoking and illicit drugs. Additionally, alcohol plays an important role in Mexican culture, which can sometimes lead to alcoholism. The next aspect is nutrition. Hispanic food is rich in color and flavor, but immigrants often adopt the eating habits of Americans. Latinos often have breakfast, a snack, their main meal, and then their evening meal. It is also important to note that some may believe in the hot and cold theory, which shows that diseases considered to be hot must be balanced with cold foods or remedies, and vice versa. Pregnancy is the next component of Purnell's cultural assessment. With Latinos, multiple births are common, and many women do not seek prenatal care. In traditional families, men are not included in the delivery of children. For most families, abortion is considered morally wrong. Death rituals are an important aspect of Hispanic culture. Death is accepted as natural, and in Mexico, the deceased must be laid to rest 24 hours after their death. Sometimes a vigil may be requested when the patient is dying. Autopsies are acceptable if the body is respected. In regard to spirituality, the predominant religion for Latinos is Catholic. Many families and patients will often talk about the soul and spirit and might set up rosaries or pictures of saints in the patient's room. When it comes to practicing healthcare, you must remember that the patient's family is the most credible source of information. Statistically, Latinos avoid complaining about health problems and tend to overuse over-the-counter medications. Many families believe that all events are acts of God. Patients will often be modest in the healthcare setting and prefer the same-sex doctors and nurses. Finally, the last aspect in Purnell's model is healthcare practitioners. Practitioners are typically respected but seen as outsiders. New immigrants are more likely to use folk healers, and undocumented immigrants are likely to be distrustful and skittish. As of 2017, 23% of the immigrant population are undocumented. Today, immigrants account for 13.7% of the U.S. population. Additionally, in 2018, roughly 11.2 million immigrants living in the U.S. were from Mexico. Nearly half of the nation's immigrant population lives in California, Texas, and Florida. According to recent data from the Rural Immigration Network, just under 60% of undocumented immigrants reported participation in doctor visits, and less than 50% of undocumented immigrants have access to reliable health care, whereas a much higher percentage of documented immigrants have access to both of those things.
The reason undocumented immigrants do not have reliable health care is that upon entry into the United States, immigrants must meet a specific criteria established by the Immigration and Nationality Act to receive any form of federal assistance. Typically, undocumented immigrants do not go through the long process of getting federal aid, and many do not qualify for federal aid if they have applied. Therefore, undocumented immigrants end up having to visit folk healers or avoid visiting the doctor altogether. Evidence has shown positive health outcomes among immigrants with access to health care. For example, hypertension control of insured immigrants was 2 times greater than individuals without insurance.
In 2011, it was reported that undocumented immigrants were mostly Christian. Additionally, folk healers might be used by undocumented immigrants because they are able to pay by the visit and do not have to be as worried about being reported as undocumented. Some immigrants might be using other remedies from their culture or a folk healer, so it is always important to ask what they might be using to alleviate their illness when they come in for treatment.
Based on all of this information, you as a healthcare worker should now be able to care for an undocumented immigrant while being culturally competent. A plan of care for this population should include attempting to put them at ease in the hospital setting if they seem on edge. This can be done by using therapeutic communication techniques to listen to the patient, and also by finding a medical translator for their native language if necessary. It is important to note the family and patient's behavior to see what is acceptable and what is not acceptable in their culture. This will help the patient trust you and become more open. Undocumented immigrants face many barriers regarding healthcare insurance. So part of the plan might involve a social worker and attempt to reduce the cost to keep the patient comfortable with their remaining time in the hospital. Be sure to find out your patient's religious beliefs so that if there is any time for spiritual healing, that can be done as well. In comparison, it could be beneficial to know if the patient follows any particular diet, for example, the hot-cold theory. Finally, part of the care plan should be to educate undocumented patients on their options to obtain coverage for healthcare or clinics that they could go to that are set up specifically for immigrants. This is simple information that could benefit your patient's long-term health.
As previously stated, undocumented immigrants typically do not have insurance access. This limits the type of healthcare they can use and might make them less inclined to remain in the hospital even if they are extremely ill. The undocumented population also tend to fear healthcare workers because they fear being reported and deported, or they fear being discriminated against. Both of these components make it difficult for the patient to trust the nurse, and this could lead to lack of information on the patient. Finally, undocumented immigrants may not have a public health record, so the nurse will not have access to family history or past medical history of the patient.
As a healthcare worker, it is important to always provide culturally competent care. This is done by remaining informed on all cultures. Undocumented immigrants have many reasons to fear the healthcare setting, and for that reason, it's very important that those who care for them make them feel comfortable. The safer the patient feels, the easier it will be to provide proper care, which should always be the priority for healthcare workers. While there is still a long way to go, many advocate for legal change to assist undocumented immigrants in obtaining access to healthcare in the U.S. In the meantime, healthcare workers need to do their research and provide the best care possible. Thank you.